Hi folks, this is Dr. Rob Cywes. I am the CarbAddictionDoc. And today I'm going to talk about something that's very, very important, obviously, to me, but more so importantly over the last few days. I'm going to talk about doctors. I'm going to talk about you, your doctor, and almost every human being needs a doctor at some stage in their lives. That part of my title is my medical degree. I am a medical doctor. I am a surgeon, an adult general surgeon, and I'm a board-certified pediatric surgeon. My expertise is in the disease profile space of mental health, which is far away from surgery, and carbohydrate addiction. But folks, this past week, right after New Year, I got word that a good friend of mine, a colleague of mine, committed suicide. He was a doctor, a little bit younger than me. And yeah, he had some personal things going on, but ultimately his work killed him. And if you look at the statistics nationally, just MDs and DOs, doctors working in the medical space, have a twofold increase rate of suicide over anybody else. And when you add dentists and dental health workers into that equation and nurse practitioners, that's about threefold the national average. Suicide. Professionals that have worked their asses off to get to where they were, studied, spent hours, hundreds of hours, educating themselves, loving what they do, compassionate about their patients, committing suicide. And they're not committing suicide often for financial reasons or relationship reasons. It's primarily because they're no longer able to function the way they dreamed of functioning as healthcare providers. And we've reached a very, very sad state because, number one, we're losing a number of fine individuals to suicide. But if they don't commit suicide, what physicians are doing in droves because of burnout is leaving the profession, saying, screw this, I'm out. Because when the risk to self so far outweighs the benefit, why the hell should we do what we're doing? Every day I go out there and talk about a ketogenic diet, I am taking my MD degree and putting it on the chopping block. But every day I go out there and practice as a normal physician, the way I was trained to practice, I'm killing my patients. Think of that, folks. Every time I'm adhering to the standard American dietary guidelines and asking my patients, which I don't do, but if I have to ask my patients to eat that way, or prescribe a statin because they have diabetes, and prescribe diabetic medication, and ask them to eat multiple meals and snacks and eat certain amount of carbohydrates with their meals, and I know I'm killing them, but those are the standard of care guidelines. And if I don't do that, my colleagues can come down on me. I no longer have the autonomy as a physician to think and function in the best interests of my patients, which is why I became a doctor. I practice according to those guidelines because ethically I have to, but the risk is enormous to my medical degree. It is far easier for me to prescribe a useless statin to a patient than to have to explain why they died of a heart attack and I didn't prescribe a statin. On a statin, they have a heart attack, oh dear. If I didn't prescribe a statin, it's my fault. How screwed up is that? And the way this happened over the last 20 to 30 years after I became a doctor is that we used to be autonomous, we used to be in charge of thinking about our patients and being compassionate. It was a profession. But when businesses evolved to be complex systems, they imposed the same on us doctors. And they plugged us in as one cog in a complex system of business, of business administration, of hospital administration, of pharmaceutical administration, of surgical, of insurance, of medical malpractice. And we're one cog in the wheel. A cog that is as important as me as a doctor in your health is the lawyer that is going to sue me, is the administrator of the hospital that is going to try to contain costs, is the pharmaceutical company that's lying to me about medications because of the wealth that they make from those medications. Purdue Pharma, that's just the opioids. We've just become cogs in the wheel, and if we don't behave like a cog that moves the whole machine, we're screwed. Burnout? Of course. So what the hell does that have to do? Well, you're a patient. You're a person who at some stage in your life is going to benefit from a relationship with a doctor. And I know that because of the way we've had to fit into the system, the skepticism has gone through the roof. You don't think that affects burnout for us physicians? Every day, I have to pay money in malpractice to protect me from my patients. Seriously? Every day, I have to think about how does the information I'm providing for my patients, how doing the best I can with my patients, how is that going to turn around and bite me in the ass? And if I'm worried about that, I'm not going to do best for my patients. Now, I'm going to take me out of that equation because I've already resolved that issue. Come at me if you will. I'm doing the best I can, and I'm ignoring at my own peril, because it is more important that I take care of my own patients than I take care of me. And if my MD degree suffers because of it, so be it. At least I can go out with a clean conscience, knowing I did the best I could under my own circumstances for my own patients, and knowing that I'm not perfect. But too many doctors are trying to navigate that perfectionistic route about risk to me before they consider risk to the patient. And who suffers is the patient. How many surgeons won't operate on you even though you need a surgery because the risk is too high to them? You suffer. So please, please, please understand the predicament your doctor is in. And I understand your distrust. I understand how skeptical you may be of the system. But be compassionate toward your doctor. If they feel compelled to write you a statin prescription, but there's no way on God's earth you're going to take that statin, don't fight with them. Take the statin prescription. Nobody's telling you you have to take the medication. I know it's screwed up, but that's the way it works. It's sad. And there are solutions to this, but not in my lifetime, folks. It's going to get worse before it gets better. And healthcare is going to decline because healthcare is based on money, not healthcare. I practice the best I can. I do the best I can. And there are plenty of doctors like myself who've made the conscious decision to practice the healthcare they buy into based on their training, based on biological observations. More and more, doctors do blood work according to a recipe, see an abnormal number, and pharma, thank God for pharma, have produced a medication that we can throw at that number. Who the hell cares if it benefits the patient? Who the hell cares why the number is abnormal? We don't think in healthcare because we're not paid to think, and thinking has become dangerous to our own health. That's the predicament we're in. That's why we're committing suicide. That's why we're burning out. That's why we're leaving the profession. And if the good doctors leave the profession, the good doctors that care about their patients, that want to know more about their patients, rather than best practices and guidelines that we have to adhere, leave the practice of healthcare, who the hell is going to be out there when you need them? I can tell you, where I live, I've drilled a little hole in my tooth. This is just theory, it's not the truth, but I've drilled a little hole in my tooth for that arsenic pill. So that if I wake up in our big trauma facility, I know how awfully that is managed. I'm going to bite down on that thing because I'd rather kill myself than let those doctors kill me. And I'm a doctor. That's the healthcare world we live in. That's the healthcare world we live in. And I don't see it changing. I try really hard in my own practice. It's between me and my patients and what I think is best. And I'm going to tell you that. And I'm going to tell you, this is my information, this is my perspective, this is my biology. That's their biology. You're a smart person. Listen to both opinions and make the decision for yourself. I'm not going to tell you don't take a statin, but I'm going to give you the evidence both ways and then you can decide. That is not the way it's supposed to be, but that's the way it is. Folks, be compassionate toward your provider. Whether it's a nurse practitioner, a PA, a nurse, a doctor, understand where we're coming from, have that empathy. Not everyone has made the decision to practice the way I do. Somewhat fatalistic. If I look at what my friend Tim Noakes went through, what my friend Gary Fettke and others have gone through, a guy that I respect so much has left the practice of medicine, Ken Berry. He's coming back, hopefully. God, I hope he does. But he's not practicing medicine. He's been removed from your healthcare, at least as a provider, because of the risk of the information he has to purvey, because he believes in that. Be compassionate toward your doctor, because you will need them at some stage. I hope this gives you some insight into the plight of the person whose office you're sitting in, who you're angry at, who you're disappointed in, who you're berating. Scale it back a little bit. Just listen. You're smart. You can make up your own mind. Do the best by you, but don't demonize those trying to take care of you. They're doing the best they can. I never want to bury another colleague who took their own life because of the system. Just as an aside, you know how many hours I have to sit at a keyboard documenting and writing stuff, and then it's still not good enough? More than half my clinical time is spent interfacing with a computer, putting notes in there. I'm terrible with computers, electronic medical records, because we've got to document it. I don't care if the patient lives or dies, as long as it's carefully documented with timestamps, and if you weren't on time, you got... Seriously? That's healthcare, folks. Good luck out there. The best you can do is take care of yourself so you don't need us. And don't text and drive. Maybe I'll see you next time.